Hi, I'm Glory Ngim and today I'm joined by Dr. Rohit Khurana, a cardiologist at Gleneagles Hospital. The subject of pre-exercise cardiac screening is not something we hear much about, and most people believe it's only necessary for professional sportswomen and sportsmen. Dr. Khurana is going to tell us why it's important, what it involves, and what it might suggest about the health of your heart. Hi Dr. Khurana, thank you for joining us today. Can you tell us what is pre-exercise cardiac screening and why is it important?
The whole notion of cardiac screening is to try and pick up problems that could potentially place that individual at higher risk when they participate in competitive sports or high intensity exercise. So the idea behind it is that we try and identify the causes of structural heart problems that can predispose people to a cardiac event.
What does the information from a screening tell you about a person's health?
In the younger individuals, whom we'll classify as younger than 35 years old, we're looking to see whether they've got any evidence of holes in the heart, whether they've got any thickened heart muscle, or whether they've got any heart valve problems.
How frequently should one attend pre-exercise cardiac screening?
Essentially, people should go for a cardiac screen if they're regularly indulging in high-intensity exercise, so before maybe they participate in a marathon or they take part in competitive exercise.
Cool, I think we've heard all about it, so I think it's time for me to get one done.
Absolutely, by all means. Glory, thank you for putting yourself through a cardiac screen. Part of this is to take an ECG, an electrocardiogram, which is simply a snapshot of the heart's electrical activity. Now, what we're looking for is to see whether there are any abnormal morphology appearances that could suggest a prior cardiac problem, and it's all absolutely fine. This is the next part of the cardiac screen, called an echocardiogram. This is a painless and radiation-free way of assessing the heart muscle chambers and the structures inside the heart. You're here for the final part of the pre-exercise cardiac screen, and this is what is called a treadmill exercise test. The purpose of this test is to identify whether you have any blockages inside your heart arteries.
So I've just done the ECG, I've done an ultrasound, and I've just taken the treadmill test. What's the verdict?
Glory, all good. Thank you for having the tests. It's all completely normal. You have a structurally normal heart, your exercise test was great, your ECG was normal, there's nothing to suggest any higher risk in the family history and the series of questions I've asked you, so your next time on camera will be running a marathon.
Excellent. I'm looking forward to it. So I guess we all know the importance of taking a pre-exercise cardiac screening.